As a chiropractor for 46 years, I didn't deal with pain as a goal. Getting rid of your pain was not my goal. My goal was to get to the underlying problem, and guess what? Then the pain and the inflammation go away. And the reason why I point this out is that there are technologies in medicine out there that focus on, for example, the inflammation. So if I got rid of the inflammation, but I didn't get rid of the underlying problem, I wouldn't be happy with that. It's not about getting rid of the inflammation. It's about getting to the cause of the problem.
That's why I always look deeper to support the root of the issue, not just the visible signs. And tools like full-body red light therapy can be helpful in that process.
Our goal was never about just pain. I would often have to tell my patients my biggest concern is that you're going to start feeling better before you are. Because we can get people typically out of pain early on, but the still underlying problem is still there. And then they go, well, I feel better, so they go and play that, hour of basketball, and now they're worse than ever. So if we can stabilize it, if we can hold that part of their body and have them help us by doing the right habits in their life. Have you ever seen any of my videos on sitting, standing, and sleeping yet? Not everybody sits all day, and not everybody stands all day, but everybody sleeps. And it was amazing how many patients would come to my office, and they were messing us up because of their bed, their pillow, and their posture. And we would clean that up, and now all of a sudden, I can do the correction, and they're not going to go home and screw everything up each time. It's the same thing with diet and nutrition or whatever. If I work hard in the office and then they go home and eat like a nut, it ain't going to help. So when you combine all of that, and I know this is a very roundabout way of talking about inflammation and pain, but it happens to be an important thing that I discuss with people, because that I hear about people, can you get me out of pain? I told my patient, I said, okay, no, we need to get to the underlying problem.